Do you go out of your way to make sure that the care space that you are working in is therapeutic? I mean, do you go out of your way to create a therapeutic environment in your workspace? What's going on, guys? DrSean here. I'm the author of Practicing TLC, Practicing the Language of Choice. I wanted to talk to you today about cultivating, creating a therapeutic environment where you work in your space. Down through the years, when we focused on patient experience, all of our attention went on the reason why we went into these businesses in the first place, into these fields, into these careers. We wanted to give, and we wanted to take care of the people in our community that had health conditions. However, what we learned, and especially COVID taught us this, what we learned is that we left ourselves out of the equation, and so we were getting burned out. What we have learned is that we can't just have patient experience without taking care of ourselves. And so we started to talk more about the healthcare environment. What we really needed to focus on was the overall healthcare experience. And so what we realized is that we have to take care of ourselves and one another in order to bring our best to the patients that we want to take care of. Now, some approaches that I find helpful in that regard is to show up and create a therapeutic environment with interest, curiosity, and concern. Now, these terms may seem very generic, but when I show up in a nursing station or when I show up in the physician's lounge and I talk to colleagues with an interest in how they're doing as people, when I show up concerned about how they are showing up, if they are having a cup that's half full, when I show up and I'm curious about who else is at home, what kind of support structures they have, it means so much when we have these 30-second discussions, even sharing over a lunch or a cup of coffee. We are able to fill one another's cups. We have these conversations in the nursing stations as well. Who has recently gotten a certificate? Just really building up one another so that we have full cups and full spirits, full hearts, so that we can go on together to take care of the missions that we went into these careers for. So my recommendation is to show up with curiosity, interest, and concern to cultivate the healthcare environment that we'll be happy with and that is very therapeutic. And when we do that, we're able to bring that same interest, curiosity, and concern to our patients that we can help them keep winning. Take care, guys.